victim of the disease sinusitis, that is a respiratory disease. My team is confirmed by Miss Aranda Hernandez, José Luis Díaz, Jorge Arturo Mera Rivas, Melissa Lizárraga, and me, Camilo Osuna. I hope you enjoyed this video and you learned a lot of this disease and how to prevent it. I'm sorry I haven't introduced myself yet formally. I'm the Doctora Camilo Osuna and I teach at Harvard. I love my job as a doctor, and doing this video is very special for me. Well, I'm going to explain what is sinusitis. Sinusitis is an inflammation of swelling the tissue lining the sinuses. Healthy sinuses are filled with air, but when they become blocked and filled with fluid, germs can grow and cause an infection. So there's many conditions that can cause sinus blockage, and these ones include the common cold, allergic rhinitis, small growths in the lining of the nose called nasal polyps, and a deviated septum. This is a septum, so if it's deviated, you can get sinusitis. There are 4 types of sinusitis. We have acute sinusitis, subacute sinusitis, chronic sinusitis, recurrent sinusitis, and each one has a different lasting time. Some ones can be for life, and some ones can be cured and last less, and other ones last longer. The symptoms are facial pain or pressure, like here, a stuffed up nose, like you feel your nose so full with mucus, runny nose, loss of smell, cough or congestion. You may also have fever, bad breath, fatigue, and dental pain. We also have the symptoms of a chronic sinusitis disease, that is a feeling of congestion or fullness in your face, a nasal obstruction or nasal blockage, that is that you can not breathe with no pus in the nasal cavity, like the green thing that is so disgusting. But because I'm a doctor, I don't get disgusted like those kind of things, because I get a lot of patients with sinusitis. Fun fact, not so fun for the people that is sick, but we have 35 million per year of people that get sick of sinusitis. 35 million of Americans get sick only in America. So yeah, this is very common and it's so annoying. I never had sinusitis, but my patients go like crazy because they cannot breathe. It's so sad, really. So yeah.
Greetings, I'm the Dr. Melissa Lizárraga, and as my other comments are talking about the disease of the name sinusitis, I'm going to mention the risk factors about it. So please people, be warned. Okay, let's start. Smoking and being exposed to secondhand smoke increases your risk of developing sinusitis. So please people, whatever you do, please do not smoke cigarettes or any kind of drug that of course has to be with smoke. Please don't. Okay, any certain medical condition like arisen cold, polyps, facial bone abnormalities, and even a tumor and allergies can cause it. And chronic illnesses like HIV infection, diabetes, and cystic fibrosis. Okay, let's be clear with this. Head injury or any medical condition that has to be with the nose increases your risk of developing this disease. Yeah, any of those. Okay, now other facts that are the age and the gender. Okay, in the age, commonly elder people are the ones who are in danger of the disease. Young people can of course get the sinusitis thing, but elders because they're old and they're commonly the ones who always have respiratory problems are the ones who are more in danger. Okay, in gender, women have a greater chance of developing sinusitis than men. I really can't find the answer to this, but apparently it happens. Environmental factors like traveling to high altitudes, air pollution, and even in the Midwest of the US. But unfortunately, we are here in Mexico and not the US. So if you've been to those places, please take care. And finally, activities like diving. Yeah, well, yeah, diving. Because between more danger activities, you expose your nose to unhealthy places. These are the risks that you can get. Thank you very much.
Hi, I'm Dr. Nisa and I'm going to give you some advices about how can you prevent sinusitis. The first one is to prevent colds. Wash your hands often with soap and warm water. This is especially important during cold and flu season. Another one is try not to touch your face a lot. Use hand sanitizer when you can wash them. Prevent lung infections. Check with your healthcare provider about flu and pneumonia vaccines. Take steps to prevent colds and other lung infections. Stay away from crowds during flu and cold season. And the last one is eat balanced meals, exercise regularly, and get plenty of sleep. The second advice is to stay away from allergens. First, determine what are you allergic to, and then follow the steps to stay away from allergens or irritants in the air, such as dust, pollution, and pollen. Here are some options about how you can do it. The first one is to wear a mask when cleaning or consider hiring a cleaner to get away from the dust. Stop smoking, avoid passive smoking and other irritants. Don't spend time outdoors during peak times such as rush hour. Keep the air conditioning on during allergy seasons and clean the filter regularly. If these actions don't work or if your symptoms get worse, ask your healthcare provider for a referral for an allergy evaluation or ask for a referral to see an allergy specialist. The last one is to stimulate the humidity. Some suggestions are use a humidifier, clean it frequently to remove mold or mildew, drink several glasses of water per day, don't drink alcohol or coffee. Alcohol can cause sinus pressure and congestion, and coffee can cause dry out the lining of your sinuses. Stay away from all type of smoke, which also dries out the lining of the sinuses. This includes tobacco smoke and chemical smoke in work environments. And finally, use salt water rinses. And that's all from my part. I hope these advices have been helpful to you, and thank you for your time.
Hello, I am Dr. Boromene and I'm going to talk about the rhinosinusitis treatment. And in this treatment consists in reduce the nasal inflammation, eliminate the cause of this disease, and keep the nasal passage open. Well, this treatment depends directly in the severity of the disease. For example, at the beginning of the disease, we can apply some symptomatic treatment that consists in some decongestants, saline solutions, and analgesics. And if the disease progresses, but directly, we can apply some topical corticosteroids. And if we have several cases of rhinosinusitis, we can apply antibiotics, topical and oral corticosteroids. Well, we have three different types of treatments for this disease. The first treatment is a non-pharmacological treatment that consists of a nasal irrigation with some saline solution. Then we have the pharmacological treatment in which we can find the nasal and oral corticosteroids. We have the antibiotic aspirin, the decongestants, and the immunotherapy. And finally, we have the surgical treatment, which is applied only in patients who don't have control of their symptoms or chronic rhinosinusitis.
So, now I will talk about a real case of rhinosinusitis. There was once a patient that came into a clinic describing her symptoms as having face pain or pressure, post-nasal drip, nasal congestion, and pain in the upper jaw. She was told acute rhinosinusitis tends to follow a favorable course and have a good prognosis. The appropriate treatment minimizes the risk of complications and solves the condition. In the case of chronic rhinosinusitis, treatment generally achieves a good control over the symptoms and patients can have a good quality of life. For her treatment, she was given nasal corticosteroids, saline nasal irrigation with nasal sprays to reduce drainage and to rinse away irritants and allergies. And finally, she was also given aspirin as to act as an anti-inflammatory agent against the disease.
Hi, my name is Mia G. Lonsdale, and I'm going to give you the conclusion of our evidence from human body care. And well, basically what my teammates have explained before during this video before me is the causes and consequence of our human body, and that if we don't take care of it, certainly it could really cause serious problems. And well, we have all concluded that the main part is that the human body care is very important for us and we have to take care of it. So by doing this, you have to take care of it mentally and physically. What does this mean? Mentally, you have to, like, you don't stress out, and you do breathing techniques, because if you don't have enough air in your body, so it's just like not enough that you need each day, you could really have mentally problems. And physically, like eating healthy diet where it consists of meat, whole grains, and lettuce or vegetables. And well, I just feel that if we take care of our human body, we won't have a bigger possibility of getting infections, like for example the sinus infections. And how to prevent or avoid this problem is you have to drink a lot of water, you have to avoid dry environments, and you have to inhale steam.
Thank you so much for watching. This is a very important thing to talk about. You don't want to get sinusitis because it's so annoying. When you get the cold and you got mucus, take it out with a piece of paper, like, you know, and because you don't want to get sick. Don't swallow your mucus. No, don't do it. It's so disgusting and it's so dangerous because you can get sinusitis. And it could get chronic and then it goes like up. You don't want it. Believe me, you don't want it. Thank you for watching. Don't drink so many cold drinks. Don't do it. And take care of yourself. As a doctor, I tell you that. You can always come visit to the university I teach in Harvard, Boston. You can always come. I'm the Dr. Camilo Sunay. Thanks for your attention. Have a nice day.